Welcome to Uncaged. Today we're speaking with Sarah Ziegler. I'm really interested in talking to you about the topic that you are a guru on. Sarah is the VP of Research Compliance Services at Sitero. Sitero is a company that says that they're delivering the next generation of clinical technology solutions, and there's a lot of interesting stuff that they're focused on. But we'll be talking about really kind of bringing compliance to innovation and in an ethical way. And we'll also be talking about some of the other things that Sarah has focused on over the years, biosafety being one that I know is a personal passion point for her. And we'll touch upon that. But before we get there, Sarah, tell us a little bit about you and your career.
Sure. I got my start in science. I got my PhD at the University of Texas Medical Branch, where I was a bench scientist. I did biomedical research there on a virus called chikungunya. And I had a lot of fun. We worked with mosquitoes and mice, looking at ways that we could help treat the disease. And from there, I made a switch and I got into biosafety. And I've been in the biosafety world for over a dozen years. Did a postdoc at the NIH as well. And then I've really worked my way through multiple places working for biosafety as compliance officer, different locations. And then previously to working at Sitero, was actually the deputy director for the USDA at the National Bioagro-Defense Facility in Manhattan, Kansas.
Wow.
But I've been now Sitero for about a year and a half and been leading their research compliance services department.
Very, very cool. What an incredible background. Manhattan, Kansas. Always it was a Manhattan. I didn't know that was in New York, but no, it's in Kansas. Makes much more sense. So tell me a little bit more about the work that you're doing now at Sitero.
Absolutely. So it's really exciting. I lead our group in consulting services, and we function with multiple different committees that help different aspects of research and their compliance. So biosafety and the IBC is one of them. We also work with IRBs. We have our own external IRB. And then a whole bunch of other acronyms as well. I usually joke and say if it's an acronym and it's a committee, then I'm leading the way with that one. But we've got DSMB and IACUC and SCRO, and it's really exciting to be working with so many different clients in so many different areas of research, from preclinical research to phase 3 trials, different ways that we can bring, health to communities and that sort of thing.
What an interesting space to be working in. I mentioned before the show that I'd listened to a podcast about research and some changes that were happening. Really, the podcast focused more on published research and how they're trying to figure out how to vet that process more effectively. But wow, I know in clinical research, there's been just tons of changes and certainly such pressure to move faster and faster through the process. Tell me a little bit about what's happening right now in the field.
Absolutely. So on the compliance services side, there's a lot of oversight going in to make sure that everything is done in like an ethical way. So one of the reason Sitero was founded is some of the other players in the industry are kind of doing this rubber stamping of things,
Mm.
and it's pay to play type of thing, and we're really pushing to not do that. So for us, it's ethics and safety first. And we're not going to promise that you're always going to be approved. So it's really trying to like separate kind of the dollars from the review services.
Yeah.
And I think that's one of the things that's really important for me, is that we're not just a commercial entity trying to make money, even though, yes, we're trying to make money, but trying to separate that to make sure we're doing the right thing by the people.
I completely agree. I'm so happy that you guys are in existence. It's a funny one because I look at a lot of research myself. I'm a professor as well. Every once in a while I come across a study that gets just tons of press. And I'll then do what probably any academic would do, which is I'll then go to the research report and I'll look at it really closely. And sometimes it's just shocking to see perhaps maybe like how small the sample size was, how many things had to be removed to get to the result that they got to. And I'm
Yeah.
and I'm reading through that data and I'm almost like, how was this published in like a tier one publication? Like, how did they not see that? I mean, anyone that does research knows that there are certain kind of sample sizes that need to be hit to correspond to any meaningful result. So, I mean, I think it's wonderful that you're doing it. And clearly, you've had this incredible career working in this space. Tell me a little bit about what drives your passion for what you do.
I'm actually really idealistic. So I would say when I was younger, it was I was going to cure cancer, I was
Hmm.
going to feed the world, all of that. And so I got into science and research really from the health side of wanting to help people. I was never going to be a doctor. That just was not going to be me. I was always a scientist. And then when I made the jump to biosafety, I realized instead of working on like one disease for like my whole career, I could help like all of the researchers at the
Mm,
institution. Like I could have impact like more broadly by getting into compliance services.
yeah.
And that was really exciting to me to be able to do that. So back to, what drives me, my passion is people. And I am a people first, that's my philosophy, that's my leadership style. That is, when we're looking at studies, it's participants first. When we're talking about worker safety, it's people.
Hmm.
And that's where it all comes down to. And anything we do, like a business, the most important, commodity you have are the people that work for you.
Yeah.
So I think that it just really comes down to that is I want to help people.
I love that. And for some reason in our world today, we sometimes forget that. It's an incredible thing. We get too attached to the acronyms and the buzzwords and all of that type of stuff, and then we forget. Oh, wait a minute. Wait a minute. This has to be good for human beings, for people, and how we can move things forward. Well, Sarah, I want you to stay an idealist and make sure this stuff happens, but here we are in a year where perhaps maybe more pragmatic and practical thinking is necessary. Tell me a little bit on what's on the docket for you and the team in 2024.
So, big goal for us is growing the business. We started in 2022. And last year was, kind of our launching point for our services, and we did great, for it being our first year in business. So this is year number two. And so it's taking what we did and just multiplying it.
Mm,
So it's really exciting for me. I like the entrepreneurial side of everything as well.
hmm.
So we are going to be hiring and growing and figuring out how to grow everything to scale. So that's a challenge in itself as well of separating yourself and how can you still give great customer service, make your people first, but now do this on a big scale.
Yeah.
So I don't want a call center. I don't want a call center for my team. I want you to have like a point to talk to. But how do I do that for, instead of 10 customers for 100 customers?
Yeah.
So it's things like that. That's what's exciting for me for 2024.
What a great goal. Certainly, I would say you mentioned call centers. I feel like call centers are one of those things where it seemed great on paper, and some finance director was like, yeah, this is going to save us a lot of money and it'll be much more efficient. But it's so horrible to what you just highlighted. It's horrible to people. And I just don't know how people think that that actually builds better relationships over time. But hopefully, maybe new technologies will make it better. I don't know, or maybe we find a different way to scale. But Sarah, I think that that's an interesting area for you to be focused on this year. And certainly, I think growth is a big topic for a lot of companies that really started in the last couple of years and are looking at 2024 to be being almost kind of like that year to stretch their wings a bit and move to the next level. Well, Sarah, it's been great chatting with you. We've been speaking with Sarah Ziegler. We've been talking to her really about some of the topics that she's focused a lot on, which is biosafety and research compliance. And we've been talking about the work that she's been doing at Sitero. Sarah, if someone wanted to reach you, where's the best place to find you?
So the easiest place would be LinkedIn. I mean, you find me on LinkedIn, shoot me a message, I'll respond back to you. And then of course, going to our website, Sitero.com. You can search me up there. There's always, a way that you can get a hold of me that way. And then happy to put my email address out there. It's really simple, sarah.ziegler@sitero.com. Happy for anyone to reach out to me that way either.
Well, listen, Sarah, it's been amazing talking to you today. We've been speaking with Sarah Ziegler. She is the Vice President of Research Compliance Services at Sitero. She has a lot of expertise in biosafety and research compliance. And she's been working in this area for a while, but really pushing forward together at Sitero to make sure that we can move clinical and drug safety to the next level. Sarah, thank you so much for being on the show today, and we look forward to having you back.
Thank you as well.